has accumulated a certain number of toxins. Otherwise, our patients wouldn't be seeing us. It's a bit like the muddy bottom of the sea. And if we use a drug that eliminates or tries to eliminate all these substances, all we sometimes do is raise the mud, and instantly the water becomes murky. In other words, there is a side effect of the detoxification, and to clear the water, we need a current to take away the toxins. So not just the right quantity of water and hydration, but also the right quality. Hence, the physician will have to learn to advise patients as to what kind of water should be drunk, when it should be drunk, and how it should be drunk at certain times of the day. And there are certain scientific publications on the subject that focus either on diet in general, considering hydration as well, or specifically on hydration only, as, for example, this one, which talks about pediatric patients, children with neoplastic disease, saying that chemotherapy has much better results if associated with drinking enough water, at least in terms of quantity. Oxygenation. Now, in terms of oxygenation, well, it's very hard in this type of situation to say that many Oriental disciplines are based upon certain types of physical exercise, and all of them on correct breathing. Correct breathing in terms of the actual movement of the body, the way we breathe, and the quality of the air we breathe. So I have my own experience. This is one of my many experiences in this field. There are certain products which have a specific antioxidant activity and enable, we have data that's being explored that permit not only to have an antioxidant activity, but to produce peripheral oxygen and thus improve the general status of the patient's health. Movement is also crucial, and in any oncological patient treatment protocol, depending on the lifestyle and the pathology, movement is absolutely essential. Both if we're talking about metabolic syndrome, as we did this morning, to try and reduce the amount of fat that can cause many pathologies, including cancer, but also to enable the human body to increase the lavage of the blood when the body is in continuous movement. Again, there's much scientific evidence for this component of the protocol, and obviously much depends on the health status and quality of life of the patient. Just a couple of words now on the medicine that I deal with specifically, because in complementary medicine, much is said about drainage. And traditional physicians identify this as a tube in a wound that enables fluids to drain out after surgery. But in actual fact, in non-complementary medicine, we're talking about stressing an organ, the cell-related activities of an organ, and the ability of it to remove toxins which may be intracellular, this is of course harder to do, or extracellular. In other words, if you have, for example, one of the most important organs in human physiology, one of the most important organs is the mesenchyma, or the extracellular tissue. Now, this is in this medical model, extracellular tissue is of the greatest importance, and this is the place where vessels come to, where the veins depart from, where nerve endings are, and active ingredients get here, drugs get here, and that's where everything happens. And it happens in such a way that the cell, it's a bit like the sea. The cell is floating in a sea, the less polluted it is, the better it enables the cells to communicate. We've heard about cytokines today. Cytokines is information that flows oftentimes from cell to cell. And to move between cells, they have to cross the mesenchyma. And it's as if a polluted sea prevented a dolphin from communicating with another dolphin. And they could become beached because they can't communicate. And likewise, a cell floating in a polluted sea cannot communicate. A cell that cannot communicate loses its ability to identify itself, and it de-differentiates itself. So I'm talking about the origins of neoplasia, the cell that loses its identity or its self-identity. And lastly, to conclude, psychological support. Now, I'm not talking about therapy or psychotherapy, because that's a completely separate area. By psychological support, I'm talking about a relationship between the physician and himself and towards the patient to understand and empathize, understanding that the patient is someone who is suffering, a person who places great weight upon the physician's words, which requires learning how to communicate. It's not just what they say, but how doctors communicate and say what they say to stimulate the healing process. In natural medicine, we do not talk about healing coming from the outside or from the doctor to the patient. The patient stimulates their own ability to heal. We talk about stimulating the patient's own ability to heal, and so patients need all the tools at their disposal to do that. Instead of saying, in 6 months, you're not going to be looking good, we say, well, you should be living what time you have left as best you can. And in the patient's experience, the patient will go home and think about our words time and time again. The information we give may have a very positive effect if given well. So to conclude, this really is a behavioral model. It's not exhaustive. It could be a much longer list. But rather than being an addition or something that others may have to deal with, should be part and parcel of what we do when we face oncological patients and deal with them. We should not overlook these aspects. For example, water. Nothing is more complex than water. So we can't simply limit ourselves to saying, well, drink this water away from meals and in this or that amount. It's very trivial, but this really is part and parcel of creating a relationship. And as far as I personally have found, and that's shared by others like myself, even if the end result is that of enabling patients to withstand their chemical treatments better, well, the patients will appreciate that enormously. Thank you.